Hello dear friends, my name is Dr. Mahesh. I am a practicing endocrinologist working at Columbia Asia Hospital, and I have my own clinic in Vijayanagar which is known as Health Roots Clinics and also as Health Roots Diabetes Center. Hypoglycemia means blood glucose level is low, and the usual number that where we define hypoglycemia is by telling that if the blood glucose is less than 70, then we call it hypoglycemia. So the symptoms of hypoglycemia can be divided into two parts, where we will have obvious symptoms related to the extra adrenal hormone that is secreted, that is the adrenaline and noradrenaline which is secreted. Next symptom that can occur is because of the reduced glucose levels in the brain, which can cause giddiness and sometimes loss of consciousness and fits, that is known as seizures. So we call the symptoms related to sweating, dryness, cramping and also shivering as hyperadrenergic symptoms, or we can also call the symptoms related to the reduced glucose levels to the brain as neuroglycopenic symptoms. So the hyperadrenergic symptoms are due to increase in the glucagon, adrenaline, noradrenaline due to low glucose levels, which results in sweating, palpitation, increased heartbeat, shivering of limbs, sometimes slurring of speech and weakness of the limbs and tendency to fall. There also sometimes there is dryness of mouth, which can result in cough, but only cough is not a main symptom of reduced glucose levels. There can be sometimes visual disturbance. So sometimes somebody may call, I cannot see properly, or blurring. In children there can be behavioral disturbances that may suddenly become angry or suddenly become soft and not talk at all or talk irrelevantly. You ask a question, what is your name? They will say, where is Bombay or where is Bangalore? So they may give haphazard answers. So whenever you see somebody who is talking irrelevantly or has these symptoms like shivering, sweating, increased movement of the limbs, or also heartbeat is going up, then definitely you need to check the sugar. If you are not able to check the sugar, then definitely ensure that you give them something to drink immediately in the form of glucose or some juice, or give some candies which can release sugar emergency, or you just put sugar in their mouth. And rarely we may have to take them to hospital if they have any symptoms of unconsciousness or seizures. So keep this in mind because we need to adjust the dose of the medicine, and also think of diseases that can be there because of low sugar. So you can think of kidney problem, liver problem, or sometimes pituitary and adrenal gland issues. So we need to do a proper investigation to see what is the cause along with the medicines that can be responsible for low sugar.